help out all of our libraries immensely.
Oh, okay. Thanks.
Okay, and I did start the recording, so we'll be able to make this available after the fact today.
All right, should I go ahead and start then?
Yeah, sure. Thanks, Ron.
Okay. My name's Ron. I'm the medical librarian at the Fargo VA Hospital. And I'm just going to go through here and do a little webinar on some COVID-19 resources. I know there's a lot of non-medical librarian people here, so I actually will be doing a little bit of down and dirty medical information for you. It'll probably help as we go along. It's not going to be too in-depth because that would take hours and hours, but it should help you understand some of the resources and what they truly are. So we're just going to go right ahead on the COVID-19 resources. We have a nice little picture down here on the left-hand corner. You can see that's the actual virus itself. So let's go through a little terminology here. What is a coronavirus? Well, coronavirus is derived from the term of corona, meaning crown or wealth, or wreath, I'm sorry. Much like the sun has a corona, as we saw in that picture, it's a small orb that has a corona of, actually, those are the receptors that engage with the cells. So that's why it's called a coronavirus. There are actually 7 human coronaviruses. Actually, the common cold is a coronavirus, and there's also a couple extra that cause mild respiratory infections. 3 serious ones. You probably heard some of these names before. MERS, if you remember that going around, that's Middle East respiratory syndrome. SARS, and actually SARS coronavirus 1. And this is what you'll be hearing also through this presentation and throughout the media. SARS coronavirus 2. So what's the difference between COVID-19 and SARS coronavirus 2? Well, COVID-19 actually stands for Coronavirus Disease 2019. COVID-19 is the actual disease. That's the actual effects that you feel. SARS coronavirus 2, severe acute respiratory syndrome, coronavirus number 2, that's the actual virus that causes the disease. So when you start looking into some of the medical literature and you talk about some of the medical topics, when they're talking about treatment, they're talking about treating COVID-19. So everyone's going to be talking about COVID-19, because they're talking about the treatment of the disease. But if you're talking about people actually starting to do a prophylaxis or prevention or vaccines, they're going to be talking about the SARS-CoV coronavirus 2, because they're going to be trying to kill the actual virus itself. We're just going to get right into the meat of the matter here. We're going to talk about our government websites. Let's see what happened to my thing here. I need to do, I'm not going to actually use these links. I'm going to go over here and do it this way. So the first one is the coronavirus.gov. Personally, I'm not a huge fan of this site because I believe the navigation is not very good, to be honest. The site is designed for the general public. Everything's pretty simple, short, in plain English. You can see there's these links, but I'm going to show you the problem with it. Okay, we jumped into the screening tool. Great. We wanted to go ahead. Well, maybe I didn't want to do that. Well, now the problem is, where's the link to get back to where I just was? There isn't one. And you're going to find that with this coronavirus.gov site. They do not have a home link on their pages. And the other thing is they really don't tell you what you're getting. So let's just hit this link here. Well, you can see they just really just blast you right in the face with a YouTube video there. And once again, no link back. There is some good information on these pages that I do like. I just don't like the navigation to get to them. These FAQs are good. And I'm going to use open a link in a new tab because that's the way I would just personally browse this page. And you can see here is some topics. Now, these are nice because, okay, should I be tested for it? Now it brings you to a nice page where you can see this is much better laid out. And you have all these show and hide panels. You can see it's brief. It's written in plain English. You can get to whichever of these want, hide. And this is nice because now if you look at the top, there is the breadcrumb up here, and you can get back to the FAQ page and back to these questions again. Once again, you're into these show and hide panels. And you can also see that they do show you the source and when it was updated. So my personal opinion, if this was a site that you would be using, I would actually just bookmark this page. It's just a lot more easier to navigate. The other one I do like are these specific resources. So let's hit travelers. Now you can see, once again on the side here, now you have links that are a navigation you're probably much more familiar with, and I think is a much more better case, or better way to navigate. Now their breadcrumb brings you back to this, once again, these unwieldy pages with who knows what all this is. So I don't like that page. So personally, I would link this page, but you can see this is good information here. This is from the CDC itself. And this is probably a little in between basic and maybe a little more informative. But you can see this is pretty in-depth. And there's plenty of links. So those are the two best resources I found from the coronavirus.gov site. And like I say, most of that is basically going to be for your general public. The second site that you're going to want to talk about from the government is from the National Institutes of Health. And it's across the top, you're going to see this is going to be you're going to see this a lot. COVID-19 is an emerging, rapidly evolving situation. Get the latest information here. Now, this site actually will keep this banner across the top, so you will be able to get back to this main site here. And you can see this has a little bit more information in it. Down here actually is going to be more of your public information. But you can see it keeping you on the same page here. And it's letting you link through this. But here you can find printable flyers. So this is, once again, a little more consumer information. But this is much easier to navigate because it always keeps it inside this little box down here. Talk about traveling, well, here's some information. So this is a nice little place to get some consumer information also. But you can see here at the top these resources from the NIH. You're going to have a lot more in-depth and maybe some more of scientific evidence through here. If you want to apply for a NIH grant, of course. But really, you're going to start seeing like this. Well, you're going to get these pop-ups saying you're leaving the government site if you're going to Flickr. But here's actual images of the SARS-CoV or coronavirus 2. But here you go, clinical trials. Now it's giving you links to the definitely more scientific information here. Clinicaltrials.gov is more so of a raw data website, but this is going to tell you about all of the clinical trials that are registered with the FDA that are being used right now. And this one is already filtered out for just COVID-19. And you can see here, they're going to tell you basically what is it for. We're going to use it, devilizumab, to combat COVID-19. They're going to tell you some basic information. Let's see, there was one that was, it's already not even on this page. I wanted to show you. Let's see, let me get 150. And then also tells you that they're recruiting, that's only being presentations. No, that's not it. Oh, I'll show you, that's totally different. So this shows you how you can get to clinical trials and get some basic information on it. I'm gonna go ahead and click this one to show you that a lot of times it really is just really basic. They're just telling you what is the study type, interventional, 25 participants, single group assignment, and I'll talk a little bit more about research study parameters later. And then they're going to tell you the outcome measures, the criterias for the people they're going to be testing. And eventually, hopefully, somebody will put the information out there. Not always. Sometimes there's reasons for that. But you can also, let's say you wanted to do a search for something completely different. So if you wanted to be using this, oops. So this is a little information to know. That's not necessarily just COVID-19, but this is a little medical background information. So here you can see, let's take a look at this study right here, because this is a completed study. So this is actually going to have all the information. So they're going to tell you everything they've done. They're going to actually tell you the arms, the interventions, what did they actually do, the outcome measures, secondary outcome measures, eligibility criteria. So who could actually get into the group of being tested, who could be excluded from the group being tested. More information, the parties responsible for conducting it. And this one actually does have the actual paper. So this is actually going to give you the information in a journal article. So this one also happens to be inside of PubMed Central. I'll talk about this a little bit later. So this one is actually totally free. So that's clinicaltrials.gov. And I just wanted to show you that real quickly because it's something that'd be nice to know. But you can also get into it. You'll see that some of this, sometimes you'll wind up getting just flat out raw data. And this is where people can take their double check some of the researches, see how it's done, and they can actually judge how well formed it is. So that was that. Let's see what's on my. Let's see I would like to. Oh, Medline Plus. Let's go there. Medline Plus, I would normally recommend if you're going to be doing consumer information for on health topics. Medline Plus is a great place to go. This is government vetted information. So you're not going to get Joe Bob's I'm a doctor, who really isn't. So you're going to get good information. However, on this time, I'm not going to recommend it, as it says right here. They say, don't look here, go back to the two sites that I just took you to. But I am going to give you a little PubMed, or sorry, a little Medline Plus demonstration here. Like, once again, we do not have as many medical librarians, but here's a good medical resource for you for consumer information. Let's just go ahead and just, heart's just the easiest thing to type in. Let's go, just go heart. And once again, you're finding all kinds of different information here. Heart diseases. What you want to find are these health topics. You can see that. This is going to be the generalized listing of information. So we hit heart diseases. And you can see they're going to give you a basic summary here. But now they're going to start giving you a bunch of different links to the information. I don't want to plug a certain place, but I do find these Mayo Foundation pages to be pretty good. And you can see they tend to be a little more in depth than just your, trifold brochure. So I do tend to like those, and they actually do recommend those a lot. You can also see information on, diagnosis and tests, preventions and risk factors, treatments and therapies. So you can see they also have a lot of information on these topics, specifics. So if people are looking for, and here's clinical trials as we saw before. So if you're looking for consumer information, this is a good place to go. But today for COVID-19, we're not going to go here. But I just wanted to point that out. Let's see. If my speech is a little bad, I'm sorry. I just had some dental work done. Oh, where's I want to find my, how can I get back to my, oh, if I do that. Okay, there. Okay, let's get really into medical information now. PubMed. PubMed is the index essentially of all of the peer-reviewed medical journal articles. You know, there's tens of millions, 30, 40 million different articles that PubMed lists. And I'm going to go into PubMed first before I show you this other new site that's out there today for the lit COVID, because there's a few things in PubMed and a few things about medical literature that I do want you to know, and I think that'll come into play as we get along here. PubMed. Okay, so here's PubMed. We're going to go through a few things here. So this will be a little off topic slightly, but it's going to be good information for you to learn how to do some medical literature searching. So right off the bat, you see there's just an obvious search bar. You can search through there doing a simple search. But I'm going to go ahead and show you this advanced search. So this is pretty good. So we're going to go ahead and just type in heart. Now you can actually tell it what field you want it to show. You can see all these different things you can apply to it. But I really want that word to be inside of the title. So I'm going to add that to my search query. You can see this search query box down here. Let's say I want to add a second thing to it. I only want to see journals or journal articles from an author with the last name of Smith. And now I can choose to use that with an or a not. So I'm going to choose an and. So now you can see my query box down here. I said I want the word heart in the title, and I want only articles written by Smith. And now I can hit search. And we have 605 results. Here you can see there's nice little ways you can start filtering your results right on the side here. You can scroll this over by time. You can tell it by what you want to see, abstracts, the free full text articles. You can find what do you want it to be, clinical trials, meta-analysis, systematic reviews. I'm going to talk about those in a minute. Randomized controlled trials. You can do by date. English is a good one. I don't see one right off the bat. If you are inside of the PubMed database and you see the title is actually in square brackets, that means that the actual article itself is not in English. It is in a foreign language. So sometimes it's easy just to hit that English saying, I don't want to see them in non-English. You can humans, which may sound funny, but also it's not, because it'll exclude things like rat trials, So that's one of the things you can do for your basic searching and advanced searching for PubMed. And that'll give you access to these articles, or they'll show you the articles, I should say. And anytime it says free PMC article, that means it's available free to everyone. And I'll talk about PubMed Central in a little bit. So let's go back. I'm going to show you these real quick, these clinical queries. So let's say we want to look at heart failure. Sure. And we're just going to do a basic search. Now you can start looking at, well, what do we want to know about heart failure? Are we looking for therapy, diagnosis, etiologies, prognoses, clinical practice, clinical prediction guides? So we'll just pick therapy. Do you want the scope to be broad or narrow? How many results do you want brought back? We're going to pick narrow. And now what you're going to see on the one hand side, this column here are going to be clinical studies. So this is all your actual broad research studies. In the middle here, we're going to have systematic reviews. And the end is going to be genetics. I'm going to go ahead and pick a systematic review here, and we're going to talk about what a systematic review is real quick. A systematic review is a review of the medical literature that is done using a scientific method. It differs from what might be considered a clinical review, because in a clinical review, it's an expert who's going through and choosing articles of their articles of their choosing to include inside of their review. The problem with that is they may come across with a selection bias. they may come across an article that they don't like because it doesn't really support their argument. They may choose to leave that out, and that might be considered selection bias. To kind of get rid of that selection bias, what you do is you actually set up a method. Like this one here. They're going to search multiple databases. Well, this is not a very great one, but usually it'll say we're choosing these certain databases, we're using these certain terms, and with this certain date range. And you're going to bring all of those back, and that way everything that's written on that subject that meets those parameters will be brought back to you. And then they go through and they choose through those which are the ones that actually truly apply to the topic, because you're going to get things that actually don't apply to the topic but might have been brought back in anyway. And then you're going to go ahead and you're going to synthesize that literature, and you're going to come up with a result. Typically, then usually you're going to have a conclusion, and then typically you're going to find a meta-analysis where they're actually going to do a much more in-depth analysis of it. Let's see one here. So that's what a systematic review is. So this does have a, let's see, can't get that one. Let's see if I can get a better one. Just to show you what the full one will look like. There we go. So here's the actual article. So here you can see here's the introduction where they want to tell you. Here's the actual methods. A systematic review will always have this methods. And they are going to tell you, here we did electronic databases of PubMed, Embase, and Google Scholar. And they wanted to know studies of a certain time frame, and they're going to study analysis that met several criteria, cohort studies, cardio risk factors. So they're telling you everything that they've done. Then they're actually going to tell you what the results are. Then they're going to start to synthesize it, and this is what you're going to see if it's a meta-analysis. This is a forest plot. Long story short, this forest plot's going to help tell you whether the causation is actually true to the study. You can see here they're always going to have a 0 or a 1 line. It doesn't matter what they call it. It just means you're adding or subtracting which way. But once you look at this, when you start crossing this line or start actually touching this line, that means that you're looking at a positive correlation or causation. So in this case, it's actually pretty good. But, and here once again, but I get a little distracted here from what we're going to talk about. But just a quick showing you the topic of some of the medical literature here. We can go too far on that. I guess I am already. Let's go back over here to, this is a good one though. We're going to talk about the MESH database. MESH are medical subject headings. It's a controlled vocabulary that of words that are defined by the National Library of Medicine. Every article that goes into Medline/PubMed is going to be looked at by a librarian, and they're going to attach these MESH headings to the articles. And they are very powerful, and they are very helpful. And I'm going to show you a perfect example of why you can use them or how they should be used. And I'm going to look at Swire Syndrome. So you have a person who comes to you and they say they have Swire Syndrome and I'd like some information. Okay, what is Swire Syndrome technically called? Gonadal dysgenesis 46XY. So if someone comes to you and tell you that they have Swire Syndrome, you're never going to guess that's what it's really called. And I'm going to show you the difference between searching with just Swire Syndrome and searching for a MESH term. So let's do a exact phrase search for Swire Syndrome. We got, oh, I spelled it wrong. What am I spelling that wrong? What am I not spelling here? Doesn't like my spelling. Okay. Oh, I'm sorry. I'm still searching in Mesh. I need to switch this over to PubMed. Okay, now in this little drop-down box, I need to change that to PubMed. So now I'm doing a PubMed search with the exact term of Swire Syndrome. I have 121 results. So let's go back to the Mesh database. And this is how you use this. You can see I have, here's the topic. You can see it's already picked it out down here. And what you do is you just add this to your search builder. It says, okay, I want to add this mesh topic, and you see it says mesh right there in brackets. I mean, it's going to search that. And we're just going to hit search PubMed. Now we have 1,000 results. Now you can see the difference between using words, especially eponyms, which are diseases named after a person, and using things that are mesh topics. We're talking close to 900 different results. So that's how mesh works in PubMed. So I think that's all I wanted to cover in PubMed. Was there any quick questions about that? I know it's kind of confusing. Okay. If not, what I'm going to do is I'm going to go ahead to Lit COVID. This is a new index/database of information that is strictly defined to be dealing with the COVID-19 and SARS-CoV-2. Remember I talked about that? It's right here. What's nice about this one is it just has these right across the top. What are you looking for? General information? What is the mechanisms? Transmission, how is it transmitted? Diagnosis, treatments, prevention, case reports. So mechanisms. So you can see that, and once again, you can start using a little bit of filtering down along the side. You can get all of them listed in one. You can get all of your citations by download. So this Lit COVID is nice because it's really up to date. Now, one thing you're going to notice is that these are not going to have mesh because they're too new. But what they've done is they started using these little tags. So it's treatment, diagnosis. So since this is too new, there's not going to be as much structure. Oh, I'm seeing questions. Okay. Do you have a preferred mesh heading for COVID? Good question. See, I don't know if there actually is one. That's a good question. Let's go to mesh. Oops, that's not right. Let's see if they have one. They may not have one. We'll just type in COVID and see what they're recommending. Oh, I'm not so sure I like that one. Oh. Yep, see, I don't think it's actually been, well, maybe they are using it, yeah. The supplementary concept, I'm not familiar with that. I wonder if they're saying that it's not fully canonized yet. But it looks like you can use it. Let's hit that. Oh, well, there you go. So it looks like there is, let's see, mesh term. It's not listed as a mesh term. Oh, it's under the supplementary concepts. So in other words, it's not technically a mesh term yet, but they needed to come up with something for now. So it's a supplementary concept. And here's the argument for it. So that's that. Oh, I wanted to go back here. Where was I? There's one thing I wanted to talk about. No, not this one. I'm not actually looking for this right now. I'm going to find. That's not what I want either. Where is it? Okay. Let me go back to my. I want to. Something I wanted to show you in here. That's right. Actually. Sorry, this is a little bit of a work in progress here. Oh, it's not going to let me do that. Okay. Previous. Let me. Where's I at? I want to go to. Yeah, nuts. Actually, here we go. Okay, I guess I wasn't really done with this one. So let's come back to this one real quick because there's something else I wanted to show you on here. We're going to get to a couple of these other later, like the treatment guidelines. The coronavirus from National Institute of Allergy and Infectious Disease, Library of Medicine. We're going to cover a couple of these. One of the things I didn't talk about over here, news releases. So this is kind of good because it has some news release. This is a good one I wanted to see here. Let's talk about medical literature again. Here we go. Clinical trial shows that remdesivir accelerates recovery from advanced COVID-19. A lot of times people read that headline and say, oh, great, now they have a cure. Well, let's actually get down and look at the research. What does it actually say? What is the actual outcome of this? Okay, preliminary results indicate patients have a 31% faster recovery time. Great. Specifically, the median time recovery was 11 days as compared to 15 days. So sometimes you need to go way past the headline and see what is really going on here. Yeah, it's helping, but you're still going to be sick for 11 days. Yes, it does reduce the time, and actually they're actually showing possible reduced risk of mortality too. So these are great things, but sometimes people will see these research headlines and they misinterpret them, thinking that, oh, great, it's a cure. No, it's not. Getting into what the actual research says is a lot more difficult. Yeah. This one, you're gonna hear a lot about this one. Hydroxychloroquine. Yep. So here's the question about this one. Is it good? Is it not? We're hearing all kinds of information. Basically, as it stands right now, the FDA has absolutely no recommendations whatsoever. There is no trials that have shown that any of these drugs that are being used are safe and effective to use. The only way these drugs are being used are in experimental matter. Now, that means that it's not a definite no, but it is also not a definite yes. As we look into this research, I'm not seeing it right off the top, a lot of this research was done in vitro. In other words, outside of the body, in the lab. So in other words, in the Petri dish, they were showing that this pharmaceutical can kill the virus itself. In vivo, inside the body, it's not as concrete yet. One thing that hasn't been addressed as much is the danger. There are dangerous side effects to this drug. And there have been several reports to the incident database. Whenever you're doing clinical drug trials, the FDA has a incident database. So if you're doing a clinical drug trial on something and some type of harmful incident happens, you have to report it to this database. So that way, if anybody else is doing this type of research on that drug, they see that in that database, and now they need to know, oh, okay, we need to be wary of this. And the problem with this drug is it causes heart problems, prolonged QT times, which is erratic heartbeats, erratic heart rhythms, and it can actually be deadly. So that's why there's a huge question about this. And this drug will never be for all, simply because of that possible effect. So if you can think about it in this way, you take one step beyond, the erratic heart rhythms actually cause lack of oxygen flow through the body, which causes dizziness, fainting spells, sometimes seizures, and also sometimes death. So if you're talking about a drug that causes that from lack of oxygen through the blood flow, and you're prescribing it to a person who has a comprised respiratory system, well, now you're kind of stacking one thing on top of another. So anybody who's receiving this drug is definitely going to have to be checked for their heart rhythms. So that's why this is, as soon as they saw, oh, this has potential possibilities, the FDA put a big shutdown on that, saying, hey, wait a minute now. We need to step back on this one because of these possibly deadly side effects. So yes, there is a possible use for this, but it's not going to be widespread. There's going to be contraindications for certain patients because of that heart disease, heart problems. So where was I? Let's see here. Let's see if I shrink that. Okay. Where was I? Okay. Oh, we just talked about that. Medical Library Association. Okay. Let's show my taskbar. Let's go back over here. So the MLA, they have a curated list of information. Here's the government resources. A lot of them we talked about already. More of them are listed there than I have talked about. And I can't go through all of these because there are so many of them. The one nice thing about this is it starts breaking things out by topics. Here's this one I like because it has specialties. It breaks things out by specialty. Here you have the statement and positions by certain specialty associations, like the American College of Cardiology. They have their own hub. Let's see what we got here. Boom, and here's their clinical guidance. Yes. So this is their statement from the American College of Cardiology. And there are going to be other people that are going to describe things as it may apply to certain populations. I think there's obstetrics here. So you're going to have the American College of Obstetricians and Gynecologists. They're going to be talking about things. Oh, here you go, breastfeeding, pregnancy. What do you need to know about that? Well, that's going to be important. And that's one nice thing about this list here is that it does have these little breakdowns here. That's why I brought this one up. Once again, you're getting some of the data, the research. Some of these are going to be some raw data dumps. Journals and publishers. One thing you get into some of these is they're going to really limit to, like the JAMA network here. It's just going to be their journals. And I think we've seen in other places that we can find a lot of information that's out there that would include more than just one. But they're not a bad place to look if you want to kind of limit yourself down, because sometimes it can certainly be overwhelming, as you can see. Public health portals and sites and education resources. So that's the MLA's page. Let's go back to my, what do we have next? Oh, Cochrane. Okay. Cochrane. Remember we talked about systematic reviews. Cochrane is one of the main players when it comes to systematic reviews. They do all their own systematic reviews. They also have one of the premier formulas for actually doing systematic reviews. So Cochrane is a big name. Here's the Cochrane resources and news. And it is temporarily unrestricted for COVID-19 information. Usually a lot of this is, you have to pay for this, and it's quite big. But you can see there's helpful resources through here. But let's see, here's our evidence. Here's our evidence and how it can help you. Plain language summaries. What about the health evidence? Here's you're going to start to find more information. So this is going to be, a lot of this winds up being a little more academic or clinical, I might say. Safer healthcare workers. Relevant to critical care, infection control prevention measures. And what it is they go through once again and they take all the medical literature and the medical information and they synthesize it to come up with one determination and one hopefully finding of fact. So the Cochrane reviews are actually really good. And I think my next one is John Hopkins. This one's kind of fun. John Hopkins here is actually dealing about epidemiology. This has a lot of good information on it. If you want to know the numbers about how this is affecting people, how it's affecting areas, how it's affecting the world, what are the numbers on these things? You can see right off the bat, the case tractor, 4 million something confirmed, almost 300,000 deaths. Here's one thing I thought was nice is these maps. How is it affecting me? What is it in my neighborhood? And here's the map. So we're just going to go ahead and zoom in on this. We want to know what is it here, and this is done by county. So we're going to zoom in here in Fargo, and I want to know about Cass County. Right up off the bat, they give you a quick synopsis here. Confirmed by the 100,000, which is proportional information, but confirmed cases, 866 confirmed cases in Cass County with 23 deaths. And if you want more information, you click the button and you get this lovely picture. You can see here there's all types of graphs and they start breaking everything out. So this is really such in-depth information by race, ethnicity, age groups. And then once again, you have numbers. Total population, new cases since the previous day, consensus data. So this has a lot of good information. So if you have patrons who are coming to you and asking for, what's the data? What are the numbers for this disease? This is a great place to get those. They're also talking about testing, how much testing is going on. Get facts about the testing, facts about the two types of tests. So this is a lot about the actual spread of the disease, news and information. So this is really good if you're looking for people who want to know the information of how bad is the spread of the disease. I'm just going to go right next. I know this is where I'm going next. Here are the treatment guidelines. Last updated of May 12th. So that's yesterday. So if you want to know what is the treatment guidelines presented by the government, this is what they are. And here are the members who all contributed to these guidelines. You can see, look, this is, once again, here's the societies and associations, how they developed them, and they're talking about that overview. Let's hit that. So now they're actually going to get into this. This is going to be more clinical view, but some people want to know that. Here's the diagnosis of it. The routes of transmission. People are wanting to know about that. Care antiviral therapies. There are no Food and Drug Administration approved drugs to treat this. Arrivals. The panel does not recommend for treatment of mild or moderate, insufficient clinical data to recommend for or against using chloroquine or hydroxychloroquine. So once again, you're going to see these information presented in a authoritative manner, because you can see who did the panel. The panel, so these are expert panels that have come up with these information. So this isn't, you know, the news cycle. This isn't, you know, somebody making guesses. These are a panel of all those specialists from all those different associations who've grouped together and made a consensus that these are the guidelines that should be used. These are the full safe guidelines that should be used as recommended by the government, using the guidelines of all those experts. So when you hear people just saying they saw something on Facebook or something, here's a good place to go ahead and search. So this is a very authoritative source of, because this is from the National Institutes of Health, and that's the treatment guidelines. So people might want to know that. This is a great place, I say, to go ahead and check for people saying, oh, I heard about, well, let's see, what does that really say? Let's see. Let's see, am I not seeing? Okay. What do we have next? I did that. Okay. This is another site that has, are people asking questions that I'm not seeing them? I lost that little screen. Okay. I'll go ahead. I can't get to that page. Okay. That's not it. That's not it. Ah, there we go. Here's, once again, I just included this. This has some additional information. This is more of a worldwide association. So there's going to have things from International World Health Organization, different other places. One thing I do like that talks about, it talks about the actual publishing. What about, you know, peer review? How fast is this happening? You know, wow, this, you know, usually the peer review process takes quite a long time, months and months. So by the time you submit your journal article to a journal, it's 3-4 months by the time it actually passes the peer review process and actually gets editorial process and actually gets printed. Well, this is such a fast happening disease, and it's because it's so, you know, deadly, they're skipping a lot of this process. Evidence-based medicine is a thing that I'm not sure if you've all heard about. A lot of people like to practice this. And this shows one of the drawbacks of evidence-based medicine is that you have to wait for the evidence. If there's no evidence because it hasn't been written in the journals, how do you make the evidence-based judgments? Actually came to a point that, let's just say there was two normally mild-mannered doctors having a rather heated discussion over the evidence in a quite public space over this evidence-based medicine. And it was quite interesting. So that's just one of the things about evidence-based medicine, is that you just don't always have the evidence. Sometimes you need to do fast reactions. So I might be digressing again. Is there any questions on the information I covered so far? Because that's most of the resources that I've talked about, that I will talk about. Once again, where's my, I'm not seeing my, oh, there it is. Oh, okay. This last one I'm going to kind of throw in here because this is interesting to us. Mitigating COVID-19 when managing paper-based circulation and other types of collections. This is actually a webinar that's free, that's been given out, and they're actually going to talk about how do you handle that? How do you handle your papers, your books and your paper and your journals? There is also a transcript of it. So that's just something I thought would be pretty good. And these are people from, you can see, Center for Disease Control, Disease Prevention Branch for Disease Control. How can you help stop the spread of COVID-19 with your circulation? So this is quite long, but I just thought that would be kind of a neat little thing to throw in there. Let's see. That's next. Oh, I think that's it. I know I kind of rambled a little bit, but I think that's basically what I was going to wanted to cover. Is there anything people wanted to go back and have me cover it more in depth? Please ask any questions. Any questions at all? People wanted to look something up, we'll go ahead and look something up.
If you have a microphone and you'd like to unmute and ask a question, that would be great. Also, I want to point out that Ron did share his slides, his PowerPoint presentation in the chat. So if you wanted to download that, you can get that there with all the links. And I imagine, Ron, we could probably share that file as well if people want it. Yes?
Yeah, I added it to the chat group. It's at
Yep.
the very top there.
And we did send out the PowerPoint link to all of the NDLA list too. So,
Oh, perfect. Okay.
yep.
Good.
And then we'll try to get this recording
Yeah.
out tomorrow as well.
Yeah, I'm kind of a rambler. Sorry about that.
No,
I could
it's
hear
great.
you, and about like a second and a half later, I heard you through.
No, it was great information. Thank
Yeah,
you for sharing all that.
Oh, sure.
Yes, thank you, Ron. That was very informative.
Good. And I was hoping to get a little bit of medical type of information out there for the non-medical librarians to help them understand when they start
Yeah.
seeing some of these things.
Yeah.
I have a question, Ron. This is
Yeah.
Donna. I'm just curious I mean, maybe you don't, but is there a particular resource that you find yourself using just to like personally keep on top of coronavirus? Like, is there one of these that you've shown us that's your favorite, or you find it the easiest to ingest?
I like the, not that one. I like this one, the NIH's page. I just find it easier to navigate. And it kind of has a mix because it does have the more in-depth research articles or research pages. This news is helpful. And you do still get your some of your consumer based. I like this one because it's just easy to get to some of the links. Secondly, if I want to actually look at the COVID research, then I do like this Let COVID because it just kind of narrows things down. I don't have to worry about all the other externalities, because you actually can do a PubMed search, and there's actually a place where you can click a link that does a PubMed search for you, and that's just unwieldy. They actually, one of the search parameters they use is Wuhan. So right off the bat, you're going, okay, you're coming really pretty wild now. Or, I've already got 17,000 publications just under this. I mean, I think you're getting the information too here. I do like the NIH site because I just find it to be a little easier to navigate. And it just gets me to the places I want to go.
Have you gotten a lot of questions from patrons about
Surprisingly, no. I don't think I've had a single question yet about COVID-19, which is surprising. I don't know. Not from any patients, not from any of the staff. Nobody has ever asked me a question. I do it just for my own information.
Yeah, that's the same experience that I've had. I think maybe everyone is too burned out to actually go out and
it's
the quality of evidence.
Yeah, I just go out and research it out of my own curiosity because I want to know what's really going on, Because like you say, you hear all these headlines and go, well, what does this headline really mean? Oh, we've got this new drug, oh, it's the silver bullet. No, it's not. Then you start reading. If you're familiar with medical literature and in medical research, you start looking into it and go, well, okay, yeah, you shaved 3 days off of it, which, I mean, it's helpful, but, because that's going to 3 days less in the hospital, can help, free up some of the burden of the hospital. But I mean, people are seeing that, oh, it's a treatment. It's, well, yeah, but let's let's just hold off on how great that really is. Or like the hydroxyquilline or whatever. I can never pronounce those darn drugs. You know, yeah, it's great till it kills you. You know, and that's one thing about clinical trials. And one thing about the literature, as I was saying before, in evidence-based medicine, one of the drawbacks behind evidence-based medicine is it requires things to actually be published. And there's such a thing as called publication bias.
Yeah, I think
And
I saw that.
yeah,
You were talking about on Twitter.
yeah. And basically the premise of that is that people don't like to write bad papers. And if you go through the clinical trials and you start seeing there's a whole lot of trials that get stopped because of dangerous side effects, you know, those trials aren't getting papers written up, you know, yeah, here's the clinical trial, I start reading it. Okay, yeah, then 2 months in, people started dropping like flies, so we had to stop it, you know, but nobody's writing a paper on that one, you know, so it's like, there's really kind of a backlash against evidence-based medicine kind of coming out. So it has its goods and its bads, you know, and well, I don't know, I can go on forever about something else, but
Well, thank you, Ron.
yeah.
Yeah, thank you so much.
Okay.
Any other?
Any other questions?
Well, we had a great crowd. We had 33 people online at one point. So
Oh, good.
thank you so much.
Sure. Well, it was a blast to do it.
The meeting.
Well, I don't know. I don't think we have anything else for today. Sarah, do you?
I don't think so, unless
Yeah.
we want to recruit members for our
Oh, yes.
health sciences section. If you're interested in learning more about HSIS, you can definitely contact me or Erica. We do some of these presentations quarterly too, so maybe we'll try to share those with the whole list.
Yeah, absolutely.
Or I guess if you have topics too that you would like us to look more into and share, we'd be more than willing to do that too.
Yeah.
Yeah, that's a great idea.
I'm sorry.
No, go ahead, Ron.
I was going to say, I think that's one of our, a great mission that we can kind of take on. And it's one of the things that we had talked about at the GMR back when we used to have an actual advisory committee. And that was getting, you know, not talking about, you know, medical resources amongst other medical librarians, but how do we get other librarians, you know, public librarians, school librarians, how do we get medical information to them? How do we teach them how to start doing this? I mean, so they're not lost. They have some kind of training in that. So I think spreading the information out to other librarians is a great idea. You know, because we could have a whole thing on PubMed, I mean, not a whole thing, but.
Well, we could have a whole thing on PubMed. That's true. Yeah.
Mm-hmm.
Yeah, and we do have a lot of people on the call today that are not in HSIS and probably not in medical libraries, so that's really fun to see.
Yeah, it was great. All right, are we good for questions then, or did anybody else have anything to ask Ron?
Oh, good. Note from Sheila, as a public librarian, it's helpful to know where to turn.
Yeah.
Awesome.
Yeah, that's kind of one of the things I was trying to get out there for, let's say if you're doing with the reference desk of the public library, you're going to get people that are going to come in and ask you, you know, now this is give you some good options that I hope to show you that you can have like just the general you know, for the general public, the simple answers, you know, the trifold brochure answers, but then also show you where you can get some of the more in depth, you know, because some are going to come in, I want to really know what's going on. You get a lot of those too. So I just wanted to give you like a little of both of those types of informations or sources.
Yeah, that was a good mix. Okay, well, I'm going to go ahead and stop the recording. So thanks again.